is quite old. It is 10 years ago. So perhaps some are not really updated, not updated to the present conditions. Next. So in this book, they say there are 3 types of archived biological materials, either identified, unlinked anonymized coded, and unlinked anonymized. Unlinked anonymized, from the bottom, unlinked anonymized means there is no identifier at all on the biological materials, and you cannot track who the owner is. It's completely anonymized and it cannot be linked. And the middle, link anonymized, Maimuna has explained, you can still link it with some identifier later, but when you work with it, it is anonymized. And perhaps you have to keep in mind that it is anonymized in the eye of the researcher. So it is not, for example, some researcher told me that I will not divulge, I will not tell who the owner of the materials. That is still in the group of identified, because the researcher know who the owner of the materials. In our setting, sometimes the materials in pathology anatomy, the researcher wants to link it with medical records, and you see that our medical records is not anonymized. You can see the names, the address, and many things. And so when you link the materials with medical records, mean the materials is identified. So yeah, and then perhaps we should have the anonym SOP for anonymation process. So to make sure that anonymation is working, because it's very important. If the anonymization is not standardized, the ethics committee cannot say whether it is properly anonymized. Next. KNPK is the body. The principles that they say in this book recognize the need to use archived biological materials for research, education, and other beneficial purposes. And KNPK also recognize the need to respect archived biological materials as a gift from a human subject. So it is not to be sold or traded, because it is a gift. And the last is archived biological material should be regarded as part of a human body, so its disposal should be done as such. So either incinerated or buried respectfully. So next. And then this is the ethical principles in the collection of archived biological materials. Collection of biological materials needs informed consent. So when you want to collect it and you want to use it for further use, you have to have an informed consent. So if you are in the hospital, you are taking a tumor, taking out a tumor, but later on you want to use it for research or for education, you have to explain to the patients that later on you want to use it for something else. And yeah, and then if you want to use it later on, use of archived biological materials besides its original purpose of collections needs informed consent. Attached to the informed consent for the original purpose of its collection. So this is if you have thought that someday I will use it for study, better you make an informed consent for collection. And then if you have that, at least you have already informed consent that you can use. Or if you don't have, you have to have a new informed consent from owners of the biological material when it is not included in the previous informed consent, or when both are not possible, you can ask waiver from the ethics committee. Next. And this is ethical approval from a health and medical research ethics committee is needed when you want to use archive biological materials for research. I think that's all. Thank you.
Okay, great. Thank you. So we go back to my last slide. And so what Vina and I are going to do is to start the discussion. We've put together 2 points, really. 2 areas that we can start leading and discussing. And we want this to be participatory. And I don't know, do we need to, someone take notes on this? What's going on? Somebody will take notes on what? Because your contribution is very important to set up the network on these issues. And because you've heard, I gave you a brief overview of the principles behind ethics, legal and social issues, and you've heard from what the situation is with archival samples. And in fact, interestingly, I suppose it's because it's 2006, it doesn't address new collections, new samples coming in, or is it any sample that's archived that will be used in the future?
Well, it actually addresses all samples that is after that. But the problem is, this book is not widely known. So there are many samples done after that is not, we don't have.
Okay,
yeah.
All right.
Yes.
So I think what we would want to do at the end of this is to put forward some recommendation that we feel will be interesting and important for us to start looking at governance or regulation for Indonesia. So the first question is, how and what would a network, your network, contribute in developing the national regulation and guidelines? Because you see, national regulation and guidelines, they depend a lot on expertise in the field to direct them. Policymakers are there, but they need experts to tell them what to do. And I think you are the most knowledgeable so far in this area, because not only because of your work, but because of your exposure in attending these kind of workshops and your interest. I'm sure you're reading a lot of these documents. So the policymakers will benefit a lot from you. And so we need to start preparing on how we feel we can advise them that it will be important and it will be fit for purpose for Indonesia. So, and we've given some ideas of what we can discuss in number 1, but you can include other things. So for instance, we think that the issue about what will be required from this network, how to interact with government and policymakers. First of all, before we ask them to help us, we need to find a way on how we're going to get there. Because as you know, policymakers have no time. They only have 5 minutes of attention. You present anything to them, they listen for the first 5 minutes. The rest of the time, they don't hearing. So we need to find a way. How do we do it? How do we invite them? How do we meet them? Who's a link? Do we need to have institutional heads to do this? Do we need to form a subcommittee, working group, or whatever? So that's the first thing. The next thing is about how we engage the research ethics committees. They're very important. The next thing is the role of the researchers, how they can help us to do this. And then the other one is the role of the community and religious leaders. And so that's what we propose for the first discussion. I don't know whether, Vina, you have to add anything here? Okay, so we can take anything in order, but we can start with the first one, or we can go in any order. Thank you.
Only for something in the practical level for each institution, how to relate research and biobanking, because we keep on having discussion regarding the informed consent and ethical issue. For instance, if we are working with hospitals, who should collect the the consent from the patients. In our case, for instance, I heard in Sarjito Hospital, they sign consent for treatment or for medical medical use, medical intention, and then should they also having consent for having their biological materials either coming from pathology department or from clinical chemistry department, the leftover of diagnosis can be used for for research intent. So that can become the second layer of consent. And in addition to that, should it be also a consent regarding specific research? That can be like third layer. I can't imagine patient has to sign 3 different things, and they in the end they said, I don't want to deal with this. This is too much for me. And also from that also request for how can we draft a consent, and in which point who should give it, who should give the asking for the consent, what is the qualification, etc. So that's on a daily basis that we really need to agree and discuss with people from ethical committee.
What we do now, if a researcher, an investigator want to collect sample for a study, a specific study, he and she should post 2 kinds of consent. One in the first consent is the consent for this study, and the second consent is the consent for leftover tissues or blood. And then the investigator doesn't need to say what are the future study he or she plans to do. What he needs to say only that any study that will be done will be submit to ethics committee for approval. That's all. So that's what we ask. So it's like a broad consent, but still giving authority for ethics committee to decide, something like that.
Okay, thanks. So that is going to be the first point now on that consent, which was missed there. So that's fine. So maybe we will continue that for the next 5 minutes on the issue of consent. And if we have any more contribution in that.
Like Buyaya say and Prof Madarina say, sometimes we as a surgeon, I'm pediatric surgeon, to be honest, sometimes it's very difficult to explain to the patient regarding the informed consent, while the parents, the really need for the parents is their children to be cured, to be underwent surgery. But in fact, we have to explain to the parents that we need their sample for the study or for the research. And my question is, how do we explain politely to the parents about the informed consent? First question. And the second, I totally agree with Buyaya. So many informed consent, if we have, first is informed consent about medical intention, the second is for our study, and the third is for biobank. So how do we, is too much effort for the surgeon itself? Because the surgeon doesn't, if they don't have any intention research, so why do we care about the biobank? But if I am pediatric surgeon and I am researcher, I do believe that this is benefit for us. But for the surgeon, if doesn't have any interest in research, it's very difficult to convince them that this is will benefit for the patient in the future. And then for the third question regarding the MTA and ethical approval, which one is coming first? We have to be MTA first signed by both institutions, and then we go to ethical approval, or we should receive ethical approval first and then we go to MTA. Thank
Yes.
you.
I'll answer your second one. It's easy. Ethics committee within the biobank is the last point. And if you submit ethics application to our ethics committee in our biobank, we ask for ethics approval for the research to be conducted wherever it was conducted. We need that approval first before we then provide the ethics to supply the sample and the data. So ethics definitely, and once all of that has been completed, then you go to MTA. You raised a very important question, and I was thinking when Ayaya was talking about this, how do you feel about this issue of this multi-layer consent form? I think that used to be the case in some organizations before now, but because of exactly the complexity that you've explained, and I want to believe that what we will be discussing here would be proposal and guidelines for the way forward. We know what the issue is. We have heard what international guidelines, and some of you have read. We want us to be thinking in a more pragmatic way. How do we think will be the best way forward? The double layer or even triple layer of consent, it complicates things. And as much as some of our colleagues think that they are not interested in research, that's probably their opinion now, but maybe that would change. So my question to you is, how do you feel about recommending a single consent model for every patient that comes and say that your sample might be included in the biobank for research? That's the question we need to ask. How do you feel? How do you feel about proposing that in a regulation for your network?
About informed consent, just want to share with you that I'm from Sarjito Hospital, that we have general consent from the beginning patient come. So it's referred to the GCI accreditation that hospital should provide the general consent. That include the right and responsibility of the subject, patient. So I just thinking about now it depend of the study, each study. Example, our study is clinical trial. So in our informed consent, there is one point that patient will agree or not agree if the sample will be used for the future study. But just thinking about this issue, if that issue will insert in the general consent in the beginning, so it could be easier to us not to give several or every layer consent. So just spontaneous thinking, because in general consent, it's already, it have to be done in the beginning, patient come in the first time.
But
so
there is a possibility. I, a patient, I agree to the surgery, but I don't want my sample to be
Yes.
different things.
They can
Yeah.
say no,
Yeah.
they don't want to participate.
yeah, because it's there is a right to refuse, right? So they can put and tick, okay, agree, but not agree to be stored.
Yes.
So we cannot store the
Yeah.
sample or the left
Sure.
tissue over.
And even when they agree, they can come back and say, I agreed before, but I don't want to anymore. So please remove my sample. So they still can
Yeah.
come out of the study.
But there is issue of too many things to things at the same time.
But if you're collecting consent, it's one thing.
Yeah, collecting consents, but because there are so many things to include it, they have to think, do I have to agree for the medical procedures? And next, do I have to agree on the this study, if it is triple consent? And then the next one is, do I have to agree on the storing of the samples? Some of the doctors, do you think they are in the state of mind to do multiple
Yes.
agreement at the same time?
That's a valid question.
Yeah.
Answer. President wants to-
Please.
I think there are two issues about the consent: the multi-layers and who the person who take the consent. If the consent should be in one layer, then there's probably the clinician will take this, because it cover the consent for medical treatment and also for the donation of the sample for future studies. There is possibility that the patient feel have to agree, because he feel that if I refuse, then probably the medication, the treatment from the doctor will be different from if we, that's the point. So some people consider that this is a little bit unethical. So we put the patient in the position that he have to agree to the
Because they are vulnerable at that time.
yeah. So what I do in my institution, that there are two layers. First, taken by the clinician for the medical treatment, and then the second is for the donation of the tissue. And we for the donation of the tissue, we have a special person, consenting nurse. So she will chasing the patient afterwards to get the consent.
After the procedures.
Yes. So the consent for the tissue donation is not an urgent one, not like the consent for the medical treatment. So we can give time, so we are not forcing the patient to think about many things in one time in the critical condition. So we can give time to the patient to think about, also for the parent of the pediatrician patient to think about, and we give time to 3 months. If after 3 months we fail to get the consent, then we will destroy it. This is what we do in our institution.
I think that's a very nice model. Anyone want to add just one more now before we move to the next on the same theme about the consent? Is anyone else, any other institution doing it the same way as we've just heard? No. So who's at the moment, apart from your group, who's collecting broad consent at the moment? At any point, any level?
The nursing.
No, I mean any other institution here.
Or any other institution.
Any other institution collecting broad consent at the moment? No. Okay. Okay. If there's no other contribution on the consent, can we move to the next bit about? Sorry.
Can I ask, what happened if the patient died?
If the patient die, if the family, we divide it into, if it is adult, then we throw it away. If it is pediatric, probably we can ask the parents. If they refuse, then we throw it away.
Okay, thanks.
But so you are storing it for 3 months?
No, we give time 3 months to get the consent.
Yeah. So you store it for 3 months first,
yes,
and then decide whether to throw it away or not.
Yes.
Yeah.
But you don't throw away pathology anyway the same year. What's your policy on keeping tissue after diagnosis?
I mean, not using in the biobank.
Yeah, so they would leave it in the pathology lab. Yeah. So, any last comment on consent before we move? Yeah, thanks.
Thank you. I'm from Danmarks Cancer Hospital. We are just want to start about the biorepository and about the consent. I want to ask the experience from Cipto Mangunkusumo Hospital. Some our doctors wants to store the tissue, and also they want store the blood plasma or something like that from the beginning, because they some have want to do the research, but some doctor is only for the biorepository purposes. So what is in your institution also take the for the also tissue, or also for the biorepository you take also the serum or the blood also for the patient sample? And for the adult, if the patient was maybe not able to take the consent in 3 months, can we take consent from the other person, like the wife or the parents? Thank you.
For the first question, we are starting actually the biobanking, and mainly now we collecting the tissue, frozen and paraffin embedded. But there is now one research project want to collect the placenta, and they also want to collect the blood cord. So we facilitate them to deal with this. And the second question about the consent, if we fail to get the consent after 3 months for adult, actually for adult, the what you call it, the limitation to not to be able to take the consent is only if the adult is unconscious, yeah, and or psychologically mental disorder, yeah. So we could ask the family, but if we fail to get due to the pathway, so we do not ask the family.
Okay.
So just we do not include it in the collection.
Okay. Thank you very much. So,
I just so blood is also tissue. Blood is also tissue. So when we say tissue, blood is also tissue, and hair and faces. So
biological sample.
Yeah.
So, thank you very much. I think that's really interesting. We've covered, I don't know what you can conclude from that, but there you are. Now, so what about engaging policymakers and government? How would this network approach that? Because we all discussed this morning that government must come in, policymakers, we must. Okay, how do we go about it? How do we do it? Any discussion on it?
The book that I read is made by the Network and Ethics Committee, and it is under the Ministry of Health. Perhaps we have to engage from that point.
And my question is, how do we do it as a network? Do we form a working group in the network to deal with this? And that network will now find a way within the institution to engage the leaders and see how we approach this? Or is there another way that you can engage the government and policymakers?
I don't know if there any network in biobanking, because we have a network in ethics committee.
So you're the new one. Okay.
Yeah.
So you're proposing that you work with the ethics committee to do this. So ethics committee members in institutions are appointed by the head of the institution.
Yeah.
Do you have a national ethics committee?
No, but we have
A regional ethics committee?
no. So we don't have a national or regional, but we have a network of ethics committee that they meet every year.
Okay, so those are the ones. So we should include them. That's the link for us. Okay, so that they would link to government.
They are under the Ministry of Health, the network.
Good. So the big question about.
So I love the suggestion that you made. Like, now we have the National Indonesian Biobanking Network. And who wants to participate in the working group for this particular topic? You mentioned it, and then the discussion went off a little bit, but I think we should go back to getting that working group implemented.
Or do you want that to discuss at the end? Because we haven't got much time.
Yeah.
Yes, so we need volunteers. And these volunteers, obviously in any working group, there will be terms of reference which will be developed by the group. But I think anyone who feels that they can contribute to this, they have the time, they have the easy access to ethics leaders and government or policymakers and can expedite this and can contribute to this, I think it's important. So we are looking for volunteers now who would want to, and it would be very nice to have volunteers from different institutions as well in this committee. And even you can volunteer your colleagues that are not here, if you think that you have colleagues that would be very good in this. Not because you don't want to volunteer yourself, but if you feel that you have a colleague who you think can do well and with yourself, okay. So volunteers, yeah, this is your job.
Jadi Bapak Ibu, untuk kita mulai untuk mengurai satu demi satu permasalahan yang kita jumpai di biobank. Ternyata kan biobank itu layernya banyak dan mukanya banyak, tidak hanya sekedar masalah pengumpulan sampel. Dan ternyata yang berhubungan dengan etik dan regulation itu suatu masalah besar yang harus kita usahakan untuk pecahkan bersama. Usulan Maimuna itu ada benarnya kalau seandainya kita membuat seperti working group. Jadi mungkin nantinya akan jadi working group untuk etik, working group untuk SOP, working group untuk regulation. Itu akan lebih cepat dibandingkan kalau seandainya kita membahas bersama segala macam bersama jadi satu kelompok, itu akan membuat kita tidak fokus. Jadi mungkin baik jika kita mulai menunjuk tangan. Kira-kira mungkin kita bisa membuat satu kelompok terdiri atas satu working group terdiri atas 3 atau 4 orang yang secara intensif membahas satu topik saja. Jadi mungkin kalau sekarang untuk topik yang berkait dengan etik dan regulation, mungkin Bapak Ibu bisa menominasikan satu orang dari institusi Bapak Ibu. Setidaknya kita di sini punya RSCM, UI, kemudian Darmais, ada Undip, ada Unsud, ada Padang, ada Ikman, ada 6 institut. Ada lagi yang belum tersebutkan? Mungkin bisa UGM. 7, saya lupa. 7 institut, mungkin bisa 3 institut. Kalau yang mengajukan satu dari satu institut, mungkin yang untuk working group berikutnya bisa terbebaskan. Silahkan. Dari UI? Bagaimana? Oke. Oke, kalau begitu kalau kita mau, ini kan diskusi tentang LC. Jadi mungkin kalau seandainya kita mau mengikuti usulannya Dr. Gunadi, itu kita pending sampai di akhir hari. Jadi mungkin kita pikirkan ada sekitar 3 atau 4 working group. Nanti di akhir mungkin kita bisa coba urai siapa merasa lebih cocok ada di mana, begitu? Setuju? Okay. So we reached to an agreement thanks to the genius Dr. Gunadi. We are going to bring this to the end of the day. As it's gonna be like several working groups, perhaps you can already suggest, well, perhaps the same that we have with BCNet.
So maybe you have a sheet of paper that goes around and you write their names in the different.
Yeah, that's gonna be great. Yes, thank you.
Well done. Good. So we go back now to community and religious leaders. They are important, and I don't know. We need some discussion on those, or
Yeah.
yeah. Okay.
I think it's important to include religious leaders because, well, it is because of human body. Yeah, and they have many things to say about that. Yeah.
Great. So, what would be the main items to emphasize in the regulation? In fact, the consent, I was hoping that this first point we talked about consent was going to go under there, but stop anyway. So now the floor is open. What items do you think we can include in the regulation, apart from the procedure for collecting consent and the process for or the template or model for consent? What other items should we be including in a national regulation and guidelines? It's a very big area. So the floor is open.
Boleh tanya, boleh usul apa saja. Can I ask something? In the ethics committee, we often has problems deciding when this is old samples and it is not collected with informed consent. So it is collected, yeah, because it is in pathology, and then somebody wants to use it and link it with identifier because they want to know, for example, if the person died or what happened to this person later on. So they want to open the medical records. So for that, and then we have problems whether to approve this or not, because sometimes the study is so important, then it's perhaps and it might bring advancement to the benefit to the populations, but
so the question you're asking is how will this network, what will it recommend?
Recommend, yeah.
The criteria for granting access or permission to link sample
Link sample to
sample to information.
yeah.
Is it something that we should recommend, or we should say no, never?
Yeah, what do you think? Because it's our problem.
With every regulation, there should be exceptions. So maybe you would want to go down the line of not to be linked at all, except on exceptional basis or exceptional cases, and it would be, those cases will be reviewed by case, and then what you would need to do is why, how, or when will we possibly grant permission. So we need to start thinking about the situation where it will be necessary to grant permission. I think to say no forever might probably not help science and research. And we can start thinking about other networks and how they deal with this condition, this situation where we have to link sample to data. But do you have any? I know I can give the EPIC example, which I've given already, but do you have any example that one would need to?
Perhaps I can give you a description of the case. Yeah. This is on breast cancer pathology samples, and then it was not collected for research. It is in the pathology anatomy, and then some researchers want to see the medical records of the person and to link it with the samples. And then we are a bit we don't know what to do because it is this is identified samples because it is linked with the medical records. And do you think the ethics committee should approve or not?
So now this is also opening another area, which is the consent form. Now in consent form, we have to tell the participants whether they will be receiving results from us or not. And most consent form for biobanks say that we will not recontact you again, there will be no results. In this case, you're talking about returning results. So the issue now is the ethics committee has to decide whether they give permission knowing that a consent form is against what we say in the consent form, and also the mechanism to do this. And it's a problem that everybody is facing, but it's the ethics committee that has to decide, but they need guidelines on how to make this decision. Or should we have consent form that say that participants might be contacted later? We contacted later.
There is a
but there is no informed consent before. So that is our problem when we faced the GCI accreditation 3 years ago. I just thinking if there is a solution for the tissue that they already had but without consent, maybe waive or others that. So for the future, there should be a broad consent for the future.
For the future.
Yeah,
of course, ethics committee can waive. We have the authority to waive. But when we discuss in the board, do we waive or not? That's we don't have guidelines.
Refer to the book, the WA, the Kemenkes book KNPKE. Yeah, it is already mentioned.
No, there is no guidelines. When the ethics, they give authority for the ethics committee to decide.
Yeah.
But whether we can make a good decision or not, we don't have guidelines. Whether we can allow or not, we don't have guidelines.
No guidelines, so we make then.
We have to make.
We make together now. I think if it is impossible to reconsent for the archive material, then it is actually the person next to me is the expert in ethics. Probably you can share the experience.
Yeah, because in ethics committee we didn't have the guideline. Sometimes if some researcher can use the material storage, depend the project. I think the proposal. I think we can give the permission about that, because this the old of samples,
Most of the time we give permission, but the problem is we still think, do we make a right decision or not? It is.
So we put 2 items on the number 2. What items should we emphasize? One is the consent procedure and process. The other one is guidelines to ethics committees when they're reviewing requests. Okay, what next? On the number 2 that we should be considering for our recommendation. Nicely presented governance structure. What about governance structure? Should we recommend some sort of a basic structure, or recommend that each network or biobank should have a transparent and published governance structure? For biobanks, it's very important that the governance structure is well publicized. It's in the website, it's transparent, everybody knows who's responsible for what. We could include that.
What about the ownership of the tissue? Who owns the tissue? The PI or the institution?
That's what this committee should
That's a sensitive issue. Very sensitive issue. So if I may share, the question that usually asked is, what is the benefit for me? So we should think about the patient, the donor, the clinician, the researchers, and the biobankers. So let us by themselves, what benefits for them. So what is the benefit for the patients? It's not a direct benefit. What is benefit for the researchers? Probably it is direct benefit that he could get the samples easily and in a high quality. What is the benefit for the clinicians? It is not direct also. And the most important thing is, what is the benefit for the biobankers? We got nothing actually. So the biobank, I think the biobankers are a group that works, do something dedicated for the research. So we don't have any benefit to do it. So that's what we should think about it. So if we ask what is the benefit for me, then let's ask by ourselves what is benefit for us.
Yeah, I think about the ownership of the sample is a big issue everywhere. Yeah, and I agree with Bu Endang that by doing the biobank, actually we have to think about the benefits of the tissue or the biological material for every in every line. Yeah, for example, for the patients, and then what is the benefit for the researcher? Yesterday we discussed about this, Maimuna, and also for the institution and the country. But I think, it is humane when it's very humane when we thought about what is the benefit for me. But actually, it's better that. When we don't think about what is the benefit for me, I mean individually, but we have to think that the benefit is for the patient and then for the researcher, then for the institution and also for the country. And however, when we as a researcher got the samples or the biological material, it doesn't mean that the biological material belongs to me as a researcher, because however, at least we can get those biological material through our institution. So when we put that in a biobank, that it can be, I mean, we can say that it belongs to everybody wants to use that, and we put it in there and for the benefits for everybody. Should be like this.
As a biobanker, it's interesting when you go down to lifestyle level, you feel that, what am I benefiting? And I'm thinking now, what am I benefiting?
The question is for you, Maimuna.
I think as a biobanker, first of all, what do you mean by benefit? Professionally, you have a purpose, your activity, you have a role and you have objective. And as a biobanker, what we want to do is to manage a successful infrastructure. Successful in the sense that we want samples of high quality, data of high quality that are used by many people. This is our goal as a biobanker. And to do this, you need to have the right infrastructure, the right governance, the right training, and apply the right SOPs. If your biobank is doing all that, and your biobank is providing samples, you're able to employ more people, you're providing training, and you're promoting the career of people who normally would be doing something else, I think that's the benefit. For me, that's why I'm doing what I'm doing. And I think the researchers are the same. And biobanks we now have the possibility to actually also involved in publication. There is a new initiative, we didn't talk about it, the COBRA, or BRIEF initiative, which is being developed. At the end of the day, what would happen is each biobank would register for an ID with the international journals. And that ID would be coming up anytime anyone submit an article that has used your biobank. So it would provide visibility for biobank. Even if you don't participate as a co-author, your ID So anyone can come and see how much your biobank is being used by just putting in your ID, and they will see all the publication that has come from your work. So we are working hard to make sure we give biobanking visibility. So for me, that's why I'm doing what I'm doing.
I'm sitting here and I'm asking to maybe to the UGM, Ibu Yaya, is it necessary from now that we raise the awareness of the government to do the biobank in Indonesia networks, because they have funding in Balitbangkes to do the translational research. Have UGM makes the approach to the research in this country to the government. So I think that's a very huge and very hard work to do by only from the university, from the faculty. So I think we have to bring this issue in line to the government policymaker. Thank you. I don't know, can we make the proposal to the Balitbangkes to do the, maybe they have funding about the developing research, and also about the ethic committee.
They have an ethics committee. Balitbangkes has an ethics committee. Because they are the networks. But perhaps they also have sections that dealing with issue.
From our discussion last year, we also for this workshop we also invite people from the previous institution who joined the first workshop. We had discussion with people from Balitbangkes. Indeed, they have big projects regarding collection of massive amount of sample and data, on which I make an inquiry if it can be shared. Even the personnel who deal with it couldn't answer the question because it was a sensitive case, if I can say. In addition to that, Balitbangkes is perpanjangan tangan. It's an extension from Ministry of Health, on which the funding comes from Ministry of Health, and they given mandate to it. But from my point of view, the understanding of biobanking for research is not yet in place in the face of the government. Regarding the regulation that has been released by the government, they only release biobanking for service in clinic. So it is about how to make it feasible for the government that biobanking is not collecting. Biobanking is more than just collecting, but also makes research feasible and shareable. I think that's the mission of biobank. We are not a common. Well, you see that how normal bank work. They collect money, but they also make use of your money for interest. So if we try to work that practically, it can be done like that. But we also, as if we can call us already as biobankers, we have also tasked very difficult tasks to disperse our knowledge and also encourage others to share for us. But then for the Litbangkes, even them couldn't answer this last year. We will try to recontact, as you suggest, we will try to recontact and see the status of it. But as far as I know, they was planning to purchase a building for storage, which includes around 100 freezers, and then we can ask them how does it progressing and whether we can use to store our sample from the network if they would like to join the network.
I think that's a good suggestion. And I'll share with you what we are doing in Egypt. So in Egypt, they're doing exactly what you're doing, but they started 2 years ago. So they have a task force there. And in the task force, what they've done, they've involved the ministries that have anything to do with biobanking. And they're not biobankers. They're usually a desk officer responsible for health or education department within a ministry. And they've also included somebody from WHO in their task force. So think about that, either WHO or CDC, international organization. Include them. They don't have to be biobankers, but they will be the ones who will go at these meetings and talk about the network. So if you can identify those kind of people, it might help. And give them a job, put them in maybe sustainability work program or work package or working group or something. That might help.
Jadi nanti dibagi kelompok. Are we done, and when we will discuss it in groups, or?
Okay, so well, I think it was really a great discussions, and I learned a lot also from the process. And I think, yeah, we have lots of things to do to realize the dreams. Okay, so then I think it's time to have a break, and yeah, we will have 1 hour break, and we will meet again here. Thank you.